I wanted to just start with just a little bit of introduction. And so, Dr. Cardona, why don't you give me just a couple brief sentences about yourself and how you got started, and expose us all to the direct primary care model.
Sure. So my name is Jen Cardona. I am currently now a direct primary care physician, family medicine residency trained, local Jacksonville native. So I've grew up here, left for training, medical school, undergrad, but came back and have been here now consistently for the last 10 or so years. And previous to my direct primary care clinic, which I started about a year ago, I was employed by a big local hospital system for about 7 years. And after about 7 years in that system, I decided it wasn't really for me anymore. It wasn't providing any real professional satisfaction. And I decided that I needed something different, but I didn't know what it was. So I actually decided to take some time off a year ago in March 2nd, to be specific. March 2nd, 2020, March 15th, if you recall, was about the time the country shut down. And I had a lot of time to do some reflection and some research, and stumbled upon direct primary care. And here we are. Direct primary care was the model that I knew existed somewhere. I just didn't know there was a formal name for it. And this was the way that I always thought medicine should be practiced. And evidently people had been practicing like this across the country for a few years, and it was a way that I wanted to practice. And I realized how easy it was to do, and what better time to figure out how to do it than quarantine. And I decided to do it.
Wow, that's amazing. And I think a lot of people had that time to sit back and reflect during COVID, and just had that extra time to figure out what they want to do. But I often find when I bring this model up to individuals, they're like, okay, so what does that even mean, direct primary care?
Yes.
So tell us what that is.
Okay. Direct primary care is a very, very simple concept. So the first thing I want to say is that it is very simple, and there are no layers beyond what I'm about to say. It is a direct relationship between a patient and a physician, where a patient pays a monthly fee to the physician, directly to the physician, for services, period. So for the monthly fee, all of the primary care services are covered, unlimited. And those services are really dependent on what that specific provider is comfortable providing. So it's dependent, it varies between providers. Some providers are better trained or trained differently than other providers, and are comfortable doing other things than other providers are. But in general, it covers all of the visits, in-office minor procedures, in-house labs, things like that. But basically everything that a primary care provider is comfortable providing is covered under that one monthly fee, and there is nothing else attached to it. No other fee attached to it, no copay. That's it. That's it.
I think that's awesome. I think a lot of people can really appreciate the simplicity of it, right? And I think we know from personal experience and your experience back in their prior employer, the patients are often waiting. They make a call. They don't necessarily talk to who they want to talk to. They have to make sure insurance is verified, and there can be delays in care and delays in information. From what you're telling me, it sounds like none of that exists in your practice.
No. In fact, up until 2 months ago, I was a staff of one. It was just me.
Yeah.
So I was the person answering the phones. I was the person taking the patient from the waiting room to the exam room. I was taking your blood pressure. I was drawing your blood. I was doing everything. I was cleaning the toilets in the office.
Yeah.
And then about 2 months ago, I was able to hire a medical assistant, which was excellent because now we can split those differences, those chores. But yeah, so now it's a staff of two, and that's really what you get. It's a really small office kind of concept, and I really try to sort of convey the feel of small town medicine, your good old fashioned small town doc, where you are comfortable enough to just call up your family doc and get your family doc on the phone.
Yep.
And walk into your family doc's office and just be comfortable enough to know him or her by first name, and vice versa, and know everything about that other person. And just, if you need medical advice, you get medical advice, and that's it. And there is no stress or worry about a financial transaction. There is no transaction that occurs every visit, because I think that in traditional medicine right now takes up 90% of your time. And that is unfortunate, I think.
Yeah, I agree. And there's always that a little bit of awkwardness from seeing the provider and then that message being translated to an assistant or a nurse, and then going to the front and billing and asking how they want to take care of payment and everything like that. And while that's important, right? But it maybe doesn't have its place, necessarily where it's been. So, while I can definitely appreciate that. And what I love that you're telling me, and then from patients that I see myself, like the sooner that you can get to them, the less negative thoughts that they have, the less Googling that they can do to kind of take them down a pathway that they don't really need to be. And maybe a text or a call to you can alleviate that pretty quickly.
100%. And what's funny is I had this revelation once, just before I left my old job. I have, and I'm sure you have this too, I have friends who will text me all the time for advice, and I don't mind it at all. In fact, I welcome it. And I tell my friends, I said, you know what, I would rather you text me and ask me a question, call me and ask me a question, rather than go online, try and research it yourself, or worse, go to urgent care, pay whatever crazy fee if it was something that I could easily answer for you. Or even worse, try and call your primary and leave 4 messages and not get a call back.
Sure.
And if it's something very simple, or even not, you can call me and I can give you an answer, or at least give you some direction.
Sure.
So my revelation was, if my friends can do that, my patients should be able to do that. Why can my own patients, who I probably know more about than my own friends, why can they not do that? Why can they not text me or call me at 7 at night, at 8 at night, at 7 in the morning? If they are really worried about something, if they really have a question about X, Y, or Z, a rash, a pain, a medication, anything, and instead they are left at home Googling, asking neighbors, wondering if they should just go to urgent care, calling my office, leaving 4 messages, whatever. And that seemed wrong. They were my patient. They're my patient. They should be able to call and contact me and ask me those questions, because that's my job. And so that was my revelation. I thought, well, the system that we're in is, something's wrong when my own patients don't have access to me.
Yeah, I agree. And I think a lot of providers feel like you do, and that they're like, oh, I got into this for one reason, and I love my patients and I want to take care of them, but the system I'm in doesn't necessarily support that.
Right.
And what I've noticed and what you do is, you provide value over volume. And some people, and a lot of people, understand that as soon as they hear about you, and they know they have one visit with you and they're like, oh my gosh, like, where has this been? You're telling me I can text you tomorrow if I fall and something hurts, or if something feels weird, or the medication makes me feel weird, and you're there for them every step of the way.
Right. 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 And it really shouldn't take a really simple question like that, like, hey, I forgot to ask you when I was at my visit this.
Yeah.
That question takes me 10 seconds to answer.
Yeah.
In my old practice, that question would take a day to answer. And that's not right.
Yeah, well, it was a day for you, and then it took the patient 20 minutes to figure out the online portal and sign
Right.
up for it, and the messaging, and I think it has its place, and those other systems have its place, but there's a lot of people looking for what you have to offer, and it's so nice to hear that you're breaking the mold, you're getting out there, you're creating some ripple effects, and you're educating the community about what you're doing, and people want that, and
Yeah.
they just haven't heard it, they haven't had an avenue to do that yet. And yeah, that's amazing. I'm really glad to hear that.
Well, I wish I could take credit for the system. I really do. I wish I could take credit for the concept, and I will if I have to, but it's not mine. It's not
Yeah.
mine. And it's been around. Direct primary care has been around since the late 90s. I just wish I had learned about it way earlier than I did. I wish patients had learned about it way earlier than they are.
Yeah.
But nonetheless, there are, at my last count, 7 direct primary care practices in Jacksonville,
Oh,
which is amazing.
good.
And I hope that more start up in Jacksonville, because the more practices there are, the more exposure there is for everyone. And it's just great. And it gives me hope that it just will start taking off, and we can start, educating more and more and more people that there are other options.
Mm-hmm. That's awesome. So what would you say is the biggest question, or like the biggest revelation a patient has when they work with you?
Well, one, that, and I said it before, that it is not complicated. The concept is not complicated.
Okay.
It really isn't. That something as simple as just paying the physician directly for medical advice is as simple as that. And that it really does not have to involve 10 staff members and a copay and an EOB and a deductible and a coinsurance and a dictionary to translate all of that. It does not have to be that complicated. So that's the first thing. The second, and I'm sort of going to reword your question a little bit,
Yeah, go for it.
is that direct primary care is not only for those without insurance. And I think that's a misconception that a lot of people have, is that direct primary care is only for patients who don't have insurance.
Okay.
While it is very attractive to patients who don't have insurance, I would say about 70%, 60 to 70% of my current practice have insurance. They still carry commercial insurance. And I think that's for a couple of reasons. I think one, because what they have realized is that insurance does not equal access. Having insurance does not equal better care.
Mm-hmm.
And that, I think, is the biggest revelation.
Yeah.
And that is like mind-blowing.
Sure.
That for a lot of people to understand that just because you have an insurance card in your wallet does not mean you get access to your doctor, and that you have better care, and that you're still not paying for it.
Yeah.
On top of what you're paying for.
Yeah.
And so once I can get that concept understood by other people, then they can sort of think outside of the box and say, okay, wait, you mean there's actually a way to have insurance but still save money by paying for a different model at the same time. And that's sort of where, the 3/4 of my current patients have figured out. So that's the other misconception is that direct primary care is only for the uninsured, and it's certainly not. And you can save a lot of money, and in fact, save a lot of money and get better access to care.
Sure.
By maybe not using your insurance benefits.
Yeah.
So that's the other thing that I think has been a big revelation for a lot of patients.
I could totally see that. Totally see that. And it sounds like your model does really well in today's world because deductibles are doing nothing but rising, right? Yeah. And so if they can have a lower premium and maybe an HSA or some other avenue for them to save money, but then that difference goes to you and they get immediate access and they get immediate care and they get their, whatever they need. And it's still cheaper for them. And I think you're exactly right. Laying that out in front of them, big revelation.
100%. And like I said earlier, medicine's no different than any other industry. Mm-hmm. And so if you're going to shop around for the best, price on chicken, and you're going to shop around for the best price on your car or gas, shop around for the best price for your prescription, for the best price for your MRI, for the best price for anything in your medical care. Do it.
Yes.
Do not assume that you have to use or go by the rules that your insurance company tells you have to because you have that card in your wallet. Mm-hmm. And that, I think, is the paradigm that everybody thinks that they have to follow because they have paid that premium to that company and now they have that card in their wallet. And I think that's the problem that I have run into, is that's what I'm trying to get patients to understand. And it's a heresy.
Yeah.
It's heresy that I am, preaching to patients is, don't use your insurance card. And they say, what are you talking about? Don't use your insurance for that MRI. Yeah. Just pay cash.
Yeah.
And they think, whoa, what?
Yeah. And I think, that we're getting into some topics that I would love to educate the public on and let people know, like, you have a choice, like people who have the card have the power. But when you submit that power and to the insurance company, they love that, right? They make you still feel like the patient's the consumer, but at that point in time, the insurance becomes the consumer.
Correct.
And so it's a tricky model, and it's a slippery slope, but it looks like you're doing what needs to be done, and you're bucking the system, and you're opening patients' eyes to a new way of being cared for in a model that they really want, and what they've heard that medicine maybe was in the past, but it's coming back, and it's here to stay.
Yeah. Well, I think my biggest role as just a family practice physician, my biggest role is to be to have the patient's best interest at the forefront, whether it's their diabetes, whether it's their weight management, or whether it's their financial state regarding healthcare. I am their advocate. They may not like what I recommend, honestly, and half the time when I'm talking about their medical care, they don't like what I recommend, truthfully, but it's not, I'm not here to, make enemies or even make friends. I'm there because I am your patient. I am your advocate. And truthfully, most times no one is the patient's best advocate. And it really, really should be your physician. Your physician should be your best advocate. If your physician, this is my best piece of advice for every patient out there.
Let's hear it.
If your physician is not your best advocate, you need to find a different physician.
100%.
100%. And I mean that in every aspect. If your physician is not trying to make you the best patient, if your physician is not pushing you to stop smoking or reach your health goals, whatever those health goals are for you as a patient, then you need to shop around for another physician.
Absolutely.
You know, and you know, for a lot of patients, they say, well, this was the physician that was assigned to me. Well, you know, there's a process to find another physician, and just that's it. Like, you are not a prisoner to the system. You have to be you have to be your own advocate at some point to find somebody who will be yours. So that's my role. My role is to be the patient's advocate. And I think in the direct primary care system, what I have found in the old system, that was what I was trying to do, and I was struggling to do it. I was really struggling to do it, and I finally realized that I couldn't do it in that system. In this system, it's much easier to do, and I have patients who are much more willing to work with me, to help me in my role as their advocate, and it's a much easier and much more pleasurable system to be in. I will say that.
Yeah, I can hear your passion coming out there, and I love it. And I mean, like, you are demonstrating and talking about a model that is amazing, and that's how that relationship between the primary care and the patient should be. Absolutely. Absolutely. And I think people's follow-up question would be that, okay, so you're going to help me, let's say, quit smoking or manage my weight. I mean, it's in a previous model, you only had 10, 15 minutes to do that. Right. And that behavioral change and that true education takes some effort and some time on both ends. And I know your appointments are much different than that, right?
That's right. That's right. As an example, I had a new patient this week come in, and my medical assistant was putting her in a room, and I heard her ask the medical assistant, how much time do I have with Dr. Cardona? And it sort of took my medical assistant, aback, and she said, well, as much time as you want. And so it really sort of just is a whole mindset that you have to change with patients, that you're not on a schedule, and your problems don't have a defined set of time that we have to use to address, and the old model doesn't work. It just, I can't say that enough. It just doesn't work. So in my office, as we're talking, the appointments just sort of start and end organically. And I never, in my old practice, I never walked into an office and went straight to the problem.
Yeah.
Never did. Because that's not how I operate. I always walked into the office and said, hey, Mr. So-and-so, how was your vacation?
Yep.
How's your wife? How are your children? Because I'm a family medicine physician. I know the family. But they also have been waiting in my waiting room for an hour. It's just, you have to sort of set the tone. And I really just want to know the patient. I want to know what's going on. And then we get to the stuff.
Yeah.
But you can't have that entire conversation in 10 minutes. And then you also can't then talk about, your problem and look at your watch every 5 minutes, because that conversation can't happen naturally. So here in my office, we don't set a time limit. So half an hour, 45 minutes, an hour, however long organically it takes. Now, I will say that's easier to do now because I'm just at the beginning of my clinic, and I'm not as busy. So who knows how it'll be, a year from now when I do have more patients, and I might have to sort of shorten appointments. But the idea is to have more time. And I will tell you that direct primary care practices do cap their total number of patients to a smaller number. In general, it's about 600. So to give you a reference point, I had over 2,000 patients on my panel at my other practice.
Oh my
So
gosh.
that, yeah, so that should give you sort of an idea. If
Wow.
I'm going to have, at most 600 patients on my panel here, I'll have more time with patients.
Yeah, that's amazing. And I think we always get stuck on the benefits of this model for patients, right? We want to tell patients how good it is, but I mean, this model makes providers much happier too, and much and they get the passion back in their job. They love doing what they do, and so it's really a great blend. And so I don't think that's often talked about either. But in bigger systems, the burnout and the happiness can be conversations that happen all the time, where in this model it doesn't necessarily happen. So that's amazing. That's amazing. So yeah, wow, you've given us a ton of information. I've learned some new stuff, and I know people are going to really, really appreciate everything that you have to offer. And you see your passion come out in this model of care that is something that a lot of people could benefit from. So if someone wanted to reach out to you, get started with you, what would be their steps?
Well, I think the easiest would be to go on my website, which is cardonadpc.com.
Very good.
So much great information on there. There's information about the model.
Mm-hmm.
There's frequently asked questions, which I think we covered a lot of
Yeah.
today. There's a way to enroll immediately if you wanted to. That's great. My pricing is on there. So specific information about my clinic
Yep.
is on there. If you wanted to call the clinic, we certainly can do that. It's 904-551-4625 if you wanted to call the office. I also offer meet and greets. So if patients wanted to just come in and talk to me face to face about the office or about the model or have questions directly,
Yep.
there's a way to even schedule that on my website. You wouldn't even have to call the office. You could just schedule that meet and greet on the website, and there's a calendar on there. You can look at the calendar and times and see what's available.
Great.
So it's, again, everything should be simple. There's not a whole lot of complication, complexity. There are not many layers between the patient and me. Most times I'm the one answering the phones if I can. So it's easy.
Wow. It's the simplicity trend is from everything from the start to finish. And so I think a lot of people are going to appreciate that. That's amazing. Well, I know you're doing good things. I really appreciate you taking the time to just tell us a little bit about yourself and your practice and what you're doing. I can't wait to see what the next few months bring for you, and you're going to start exploding and seeing the people you want to see and getting people good care. So
Well, thank you. I so appreciate you putting this together. This is great. I love what you've been